It's Monday yet again, and you know what that means?
It's Conversations Mondays!
Welcome back, welcome back.
Yeah.
Today, mnaona set imechange.
Yes.
We are more than 2 here. Actually, we are more than 3.
Kuna watu wa BTS.
Kuna watu wa BTS. So,
Kubwa.
yeah, today we have a special episode. Tumesema tuwapatie leo tusifanye story time. Tuwapatie knowledge. We want to empower you there as a mom, and then you go ahead empower your caregivers who are at home. So we've been joined by a pediatric nurse. That's correct.
Yes.
Right? Musikwe kama mimi, musijebishe hivi. So we've been joined by a pediatric nurse. She's going to take us through the basics of first aid at home. Many accidents happen at home. Na watoto wana pass. Actually, the other day, like I think a month or a few weeks ago, tumezika mtoto wa family member, 9 months, and the kid choked. Hivyo tu. So this thing is serious. Accidents happen at home. Autojua when the child amenyongwa na machungwa, ameuma raba, alikuwa anafanya homework,
amemeza coin.
Imagine, you know, these things happen. So we have someone here to help us. Karibu sana. And let her tell us her name. Maybe she can tell us for how long she has been doing this.
Okay.
What inspired you to be here?
Yes, what's the story behind it? Uliamka tu, ulimaliza tu hivi university ukiingia hapo ama kulienda aje?
All right. So hello, my name is Priscilla Mombi, a nurse by profession, specialized in pediatric nursing. Also a mom of 3, and that's where the passion began. So I've been a nurse for the last 14 years, but specifically training and reaching out to parents and caregivers. Also, this includes teachers, daycare staff, anyone dealing with young children for the last 10 years.
Wow.
Yeah.
10 years is a long time.
Yes, yes.
How old are your kids?
And so the first one is 10, and the second one is 7, and the last one is 5 years old. Yeah.
Have you had accidents in your home where you needed to practice your first aid, choking first aid specifically?
Oh, yes, yes, yes. I remember last year when my last born was 4, they were eating this fruit, and I used to cut for him in small cubes. And then that day I told him, I think you can manage it like your older siblings. So what I did, I went back to the kitchen, and then I came back, and where they were eating from, I just sat behind them. You know, it was just lunchtime. And then all of a sudden, I think it's this mom's, you know, intuition. I just looked at him, and he turned back, and his eyes were red. Eyes were just flowing, and then he was quiet, and it's like he was, you know, mute and stuck at some point. So I quickly noticed this boy is choking. So I quickly dashed. The dad was there, but I happened to be the only one who noticed. And then I quickly dashed and got hold of him, and I did.
And you're not noticing.
But I think somehow we are so quick. So I managed to get hold of him. So I actually did the Heimlich maneuver on him once, and the fruit was out. Yeah.
Maybe unaweza tusaidia kwa wale hatujui kizungu.
What is that?
What is Heimlich maneuver?
So for Heimlich, we said it's done for children. The baby there.
Let our baby sit there.
Who are 2 and above. But for a child, you'd have to kneel down to reach their level. So what you do with Heimlich, you make a fist, and then your thumb is tucked out, and then you reach out to your baby's belly button. So assuming this is like a 3-year-old, you'd have to kneel down to reach their level. You put your fist over there. It's like facing up, and then your other hand is supporting them. And then you bend them over and then push up the muscle. So you're pushing in and up at the same time.
Yeah.
Well, this also requires a class to actually do it, practice it, and then, you know, until you get to grasp the skills. So this is for older children. Now, for the younger ones, we'd have to do something different. We call it back blows. That is for a child who's from birth to 2 years. So get hold of the chin. Well, this is a simplified version of it. You get hold of the chin, and then you sit at the edge of the chair. So you'd have to move in front a bit,
Yeah.
And then one leg is slipping down, and I put the baby facing upside down, such that the head is lower than the rest of the body. And then using my, what we call the heel of the hand, so this soft part, in between the shoulders, I would have to hit 5 times. So those are 5 back blows.
Nampiga
So how
ngumi.
hard are you
Eh,
hitting?
So the more the pressure, the better. Or rather, the sooner you're going to be out of this situation. So you hit once, twice, thrice, number 4, and 5. And then you turn baby on the side and check if there's something. So the back blows work very well. We have 2 techniques. That's the first technique. The second one, if there's nothing coming out, and of course there are signs that you're looking at, maybe baby's getting worse, it's starting to turn blue on the lips, the fingers and the toes, you'd have to try a second technique where you place the baby facing upside down, no, facing upside, upright, yeah. And then in between the chest, you'd have to use your fingers this time and do 5 chest compressions. So it's like you're digging in 2 inches in. So those are 3, and then 4 and 5, and again turn the baby on the side and check if there's something, and then scoop it out. If nothing, just know you didn't do a good job. The first time you'd have to add more pressure, and it should be out. So this is for the young ones. Even if they're choking on milk, something light, then you'd have to do that. And then maybe it's out of the situation.
So you choking. Mtu anakunywa, maybe ana breastfeed.
Yeah.
They start coughing. Is
Yeah.
that choking? Ama choking is just complete. Hawawezi, they can't breathe.
So we have 2 types of choking. Where a child is choking and they're able to cough it out and they're coughing loudly, that is called mild choking. So what you do, just allow them to cough and just say, sorry, baby, you'll be fine. That's reassuring the child. So you want to avoid tapping on the back and blowing on the forehead, what most of us are used to.
Or even blowing
Yeah.
inside the nose.
The
I've
nose,
seen people
yeah.
blowing inside the nose.
Yeah, so no tapping, no blowing. You just reassure them because the body, when they're coughing, that shows that the body is in control. It's
So
able
coughing
to
is
bring it
good.
out. So coughing is good. So when baby is coughing, just relax as a caregiver or as a parent. Yeah.
Okay. Na hii ingine ya kwanza umetuonyesha, nimeona this part is actually
Yes.
going to the navel.
Above, like an
Oh,
inch above, like an inch above.
Oh, okay.
Yeah.
So nilikuwa
But I would
nafikiri
have to
inashika
kneel
navel.
down. Of course, this we get to do it in a full session. We get to practice.
Okay.
Yeah.
So what if I do that and I repeat and nothing happens?
The secret is using good pressure, and then you're going to be out of it very soon.
Okay. Okay.
So what is it that is inspired you to be like a pediatric nurse?
Well, I discovered right after college, got my first job in 2010 in a maternity ward. So I basically worked as a midwife. But then I had this passion to reach out, to go out and reach out and train mothers in very local communities, even in their local language. Some of the topics were danger signs in children, danger signs in pregnancy, and postnatal, period. So I discovered I have a passion to reach out, share information, and prevent these accidents and deaths, as opposed to be in the hospital and taking care of them. Well, I can also function there, but there's this great passion in me to reach out with information. And I try to simplify it in a way that even someone who didn't go to school but can understand Kiswahili or a local language that I understand, then they can, go ahead and learn it.
So umeenda hadi wapi na training, like how far and what languages?
Well, I've done it in Swahili and then also in Kikuyu. And then where I don't understand the language, I would have to have an interpreter.
Oh, yeah.
Yes, so several parts of the country. Yeah, and we thank God for it. Yeah.
Yeah, so we see we bring experienced people here. We bring serious people here. We're not joking.
Yeah.
So make sure at the end of the episode you sign up to her classes. She has good classes. This is important for you and also for the house helps.
Oh,
Cindy,
yes. Oh, yes.
Yeah, so as a mom can come learn now, house managers nisirushiwe mawe, can come and then go ahead and teach the house managers.
Oh,
Cindy,
yes. Oh, yes.
so the procedure umetuonyesha hapo, is that the same as CPR? Ama what
No,
is
that's
CPR?
different.
Okay.
Wow. So CPR in full stands for cardiopulmonary resuscitation, and there are steps. So in class, we would have like an acronym to remember how to do CPR, and we go by Dr. ABC. So D, R, A, B, and C. So D stands for danger. You need to check where you're doing CPR. Is it safe? Like where we are, love the nice carpet. So this is a nice place to do CPR. and then it has to be a hard surface. Now, this is CPR at home. In hospital, it's done on a different, surface, which is raised because, again, of infections. And then next, we go to response. So like for the small baby, we have CPR categorized in terms of age groups. For the infant who's from 0 to 2, would have to check if they're responding by, simply rubbing the bottom of their sole and call them baby. Like, this is my baby Anne, and I try call them by name. And then the next step is you open the airway. So you have to do this practically on the floor. So you open the airway, so something like this, and then you blow in air. Like for the infant, you'd have to cover the nose and the mouth, blow in air twice. And then now the last step, C, is for circulation. You'd have to do chest compressions between the chest, and then 2 fingers for the infant, and you do 30 chest compressions. And you keep going. Yeah, and then it's done differently for those who are 3 years to 12, and then 13 years and above. Usually for adults, you've seen this being done in movies, so that's what we do with 2 hands, and then the small babies, 2 fingers, and then those who are from 3 to 12, you'd have to use 1 hand on the chest. Yeah.
So you've said CPR stands for?
Cardiopulmonary resuscitation. So in short, you're just going to work on their heart and their lungs, and then bring them back to life.
Na CPR inafanywa sana sana in what
In what
cases?
circumstance, yeah.
Wow, okay, that's a good question. We are doing CPR because the child or the adult is not breathing and they have no heartbeat. So one of these cases would be maybe a child who has fallen from a height and they hit their head, they're not breathing, or a child who has drowned in water, and once you get them out of maybe of the pool, they're not breathing, they have no heartbeat, because the first thing you want to work on is the heart and the lungs, so that we keep them alive. They might have gotten other injuries, but you want them to keep them to stay alive. Yeah.
Okay. And then there's also the other accidents that happen at home. Simple cuts, even fractures. How do you deal with such? How would you advise one deals with such things at home? Burns. Mtu amechomeka na uji moto.
Before that, I want you to explain to us why the first aid is important.
Okay.
Why should we take it seriously?
So I would say, like, to be very honest, for the last 10 years, journey as a parent, leave alone the nursing bit. I've had several, accidents either in the house or, in the neighborhood, and people are trying to find out what to do. So I'd say basically it's good to have the skills so that we can prevent what we call, preventable deaths and accidents. When they happen, then you'd be able to manage them well. For example, a child who's choking, if I try rush them, with the fastest car to the nearby hospital, I'd be wasting time. I would have to learn the skills and do it at home. Like if you have your house manager, they'd have to learn how to do first aid for a choking child at home before they get hold of their phone to call you. So the first action is, they get to recognize, through the class, these are the signs of severe choking. Then they get hold of the baby, and then they help them out. And of course, soon, in a few seconds, baby should be, out of danger. And then now they call you and say, Mama, hi, we are okay, but this and this happened. So it's good to have the skills so that you're able to gather even the courage and attend to them. I must say that we are so behind as a country, so behind, maybe even in Africa, to a point that we have no idea what to do when something happens. But in the developed countries, I understand that you have to take a course, before, once you deliver, before you get home. I mean, you have to have, this and these precautions because you're a parent, you have a child at home. But here we're used to getting someone from Ushago, a house help, to come. You want the most green person, and you want to teach them how to, cook, how to take care of your baby. But they have no skills of what to do in case a child is choking, a child is burnt, a child is cut. And some of them, from experience, they want to hide and keep quiet. A baby falls and they don't tell you.
They don't tell you.
So if it's a day bag, they work during the day. When you come in the evening, they're, in a hurry to go. And so at night, you're wondering, why is the baby vomiting? Why is the baby looking dull, looking like they're sleepy? But if they had, you had prepared them how to open up, and then now they would tell you, oh, baby fell, but I didn't see them, maybe sick, but you can just observe, such that you help them to open up and to share and to be free.
Yeah. When I bring someone, that's the first thing I tell them. if anything happens to the baby,
Yeah, make sure you tell me.
just tell
Yeah,
me.
yeah.
Hey, just call me and tell. I had the one who used to tell me, "Mbona just like you stress ukiwa kazini." Huh?
Oh,
Ebu stress me, please.
yeah.
Yeah, because now if you don't tell me,
Mm,
I won't even know what action to take.
it's
Maybe
true.
I may choke. Maybe ujui vile kufanya, but you
Yeah.
called me.
Yeah.
I'll be like, do 1, 2, 3.
Yeah,
So naona tumeokoa situation.
it's true.
So teach your household to be telling you things.
Eh,
Yeah,
Yeah.
and it's very important.
Yeah.
Where I live now, when I moved in, when you move in into a place, utapewa stories za kitambo za hiyo place.
Yeah.
So the security guard was telling me there was once a house help akifeed a 3-month-old, I guess, mtu hii the bottle alichoke. So because she didn't know what to do, she of course eventually baby passed on. She left the child there vizuri
Akatoroka.
na akaenda home, and the security guard was like aya aliona nikaa ameenda kwa shop or something. So jioni ndo people are trying to call her, ni mteja, the mom amecome home, and this is one of those babies umepata na shida, you know, the ones you even call prayer groups and you intercede
Yeah. Oh, it's
so that
so
you
sad.
get aka baby na hivyo ndo alipotea, you know. So teaching accidents happen, I wouldn't blame her, but of course alishtuka because she didn't know what to do, and now I'm here with a lifeless body akakimbia. So it is very important to learn these lessons. So take this episode seriously, and again I will insist, make sure you sign up for those classes. Na si someone can sign up, wanaweza sign up na sign up pia house manager or any caregiver around them, si ndio? Yeah. So if you want, you can also sign them up, mwende hizo classes pamoja.
And what are those common emergencies zenye zinakwaga with children?
Yeah.
Well, I would say one common, well, we call it a danger sign in children, is fever, and this happens to almost every child. But now the main thing around fever is how quick we get to respond to fever. Otherwise, if we don't do this, then a child is predisposed to or at risk of getting a convulsion. So a convulsion is the most scary thing that a parent would have to go through. So that's in terms of, illness. But then when it comes to accidents, it's more of falls. That means you have to childproof your house to be safe. For example, if you have a double-decker bed or what you call a bunk bed, either that room is always closed or, there's just someone, on the move, just checking on the baby, because when they're toddlers and they're walking, then you have to, keep a close eye on them. Yeah.
We have toddlers and here.
Yeah, we both have
toddler
toddlers.
has fallen twice.
Wow.
Akapasuka. The
Wow.
first time alipasuka ndani, I'm like, this part ilitaruka.
Oh, the lip.
Akaenda kashona.
Wow.
Then the second time akapasuka tena. The same place but sandani.
Oh, my.
Yeah, so toddlers, hapo ndio kuna nightmare.
Yeah. Umemention convulsion. Tuseme mtu ajui hiyo ni nini.
Okay.
Mimi hapa.
Describe what it is, and also you can tell us, as this person is convulsing, what is happening on their inside. Why are we seeing that on the outside?
Well, let me just classify them into two. So this one that we've just mentioned, convulsions, is specifically caused by fever. And the risk is in children who are from birth to 6 years. And the reason is they have a low immunity. That means ile hali ya kupambana na magonjwa iko chini. So any small infection, maybe come with some flu from work, or someone comes, the older sibling brings something from school, so they easily catch up those infections. So one of the signs and symptoms, the first one mostly is fever. Now, if you're not able to manage fever well, then the baby gets into convulsion. So what is a convulsion? It's a state where a child is, I would say, unconscious. They start by, kind of rolling their eyes. They might have a funny sound or a funny gaze on their, on their face, and then they'll be unconscious. Then, assuming this is a child, then they'll be jerking their hands and their feet, jerking. But of course, the degree matters. You can see one who's very vigorous, and then there's one who's just mild like this, and it's over like 3-5 seconds. And then there's one, epilepsy. They look like someone who has an epileptic attack. And then there'll be one who, is, having very vigorous jerking movements for close to 2 minutes. Yeah, so what to do for a child with convulsion, the first thing even the doctor will tell you, always put them on the side. But then the best and safest place should be on the ground. Well, this could work well, like a sofa like this, unless you're going to stay with them. But the floor is the best because I would, panic and maybe even leave them trying to, figure out what to do. Maybe try to grab my first aid box,
and
grab
they might
something.
fall.
Yes, so the floor is the best place. So like leaning on such a surface. And then the next thing you want to do is to avoid restraining them. Don't say, oh, my baby, just allow them. Usually we say, let them be, let them, jerk, convulse until it's over. And then the next thing you want to have a quick feel of the body just to confirm that this is actually fever which is bringing it up. And then the next thing you want to undress them if you can when the convulsion is going on. If you can, undress them because you want to bring down the temperature, which is now the main cause of the convulsion. Then if possible, you can check the time when it started and when it came to an end. So you want to time roughly how long it took. And when you go to hospital at the end of this, because we have to, a good doctor will always ask you, roughly how long did it take because it has effects on the brain. So what is basically happening is like an electric shock in the brain, but caused by fever. So this will come and end. And then if you don't manage to cool down the baby, what will happen? This will come to an end and then another one will hit and another one if you don't take action.
So during the convulsion, there's nothing much I can do really
just leave
to stop
them.
it.
Yeah, just leave them to convulse and then it comes to an end. So once it's over, now baby is going to be alert. They might look a bit confused. If they're old enough to hear, you tell them, fill them in, what happened. So at this point, you can give them maybe some water because they're alert now. Otherwise, when they're convulsing, you're not supposed to give them anything. And then what else can we give is paracetamol or whatever you have for fever. If you don't have that, then, and you have maybe what we call the Panadol suppositories, the ones we insert in the rectum, you can insert. That's the best. Because a fever that is bringing about a convulsion is so high such that a suppository would bring it down very well. So in class, we'll show you what it is, how to insert it. And then, then the next step is to give them a warm bath. Give them a warm bath. Just the way you prepare warm water, that's a temperature of about 37 degrees. Insert them in water, just give them a bath. And then what happens when you put them in warm water, it tends to regulate the body temperature. Even when a baby has fever, that's one of the things we'd recommend. So apart from giving Panadol, so the sponging, maybe you've heard about tepid sponging, which was, being done from a long time ago. Well, in my opinion, it tends to spend, take more time. But then giving them a warm bath works wonders. Yeah, so I hope I have maybe somehow highlighted what to do with a convulsion.
Yeah. So let's say I've noticed my child has fever, haja convulse. I can still give them a warm bath.
Yes.
To prevent now
okay. Perfect.
Okay.
Perfect.
Okay.
Yeah. And you can do it as many times as possible. Say, for example, if you've been given paracetamol to use, let's say every 6 hours, or like maybe 3 times in a day. So in between the doses, you can do a warm bath. Yeah.
And it's not supposed to be covered. Mfuniki,
after the warm bath.
Yeah, after the warm bath, they would have to wear light clothes. So if it's like a onesie or a light
in our
romper.
community unaambiwa valisha mtoto
Valisha
hadi
mtoto
moshoni,
sweater.
So,
assisted
Funika
by,
mtoto. Hawa watu
funika
wafunika
mtoto.
mtoto. Imagine nasa amekataa.
Yeah, so in this season where the baby has fever, just do away with extra clothes.
Even in a cold season kama
even in a
sai.
cold season, because the body is dictating something different. It's hot. It's too hot. Now, if I do a onesie plus a romper plus a sweater because of the weather plus a hat and socks, now you're making this worse. Oh, then I remember something else. A baby who has fever and the head is hot, the body is hot, but we call them the extremities, the hands and the feet are extremely cold. What most parents would do is get, a pair of socks, pair of mitten and add them.
Yeah.
So that's not what we're supposed to do. So you're supposed to undress the child. It's actually a sign that we should actually do a warm bath. So even without paracetamol, like ushago, you don't have paracetamol, no thermometer to check what kind of temperature it is. As long as unamguza and baby is hot and the rest, the hands and the feet are very cold, it's a sign that you must do a warm bath.
So what's happening in the body ndio sasa mguu na mkono pekee ndo baridi?
Would call it an imbalance of temperature because they have fever. let me just try simplify it. It's like the body is confused. There's fever, but this is the normal temperature, because normal temperature of a child should be between 36.5 to 37.5. But then this is now way above 38, 39, some even hit 40 degrees Celsius. Yeah, but we try make it as simple as possible for even a lay person to understand that this is a kind of fever.
Yeah.
We are aiming at, must do a warm bath just to prevent convulsions. Then once the conversion is over, we have to go to hospital for a checkup.
We?
Hiyo story imenishtua.
Pole.
Mi nasikianga tu watu convulsions, but I've never experienced it. But the fever, at least your bit ya asivae nguo mingi, I know.
So in layman's language,
Yes.
venye akili yangu imeelewa. So we have fever, the temperatures are too high.
Yes.
It's too hot such that my brain is electrifying my body. As in the heat is
It's too much for the body to handle.
To handle. Okay, okay.
Yes. And the only way this happens, or the body gets to express itself, is through maybe a convulsion.
Convulsion.
Yeah.
So when
Although-
you may liken to ni kama shock. So me in my head I saw shockwaves coming from the brain
Electric
to the
shock
body.
waves. Okay. So something else that can bring about a convulsion is a child who's totally dehydrated, maybe from too much diarrhea, too much vomiting, but now the dehydration is bringing about a convulsion. Yeah, but usually when this happens, when you go to hospital, then the doctors is going to help you. The doctors are going to help you to know what was the cause. They do run some tests, and then, yeah, probably they do some admission several days, and then they're good. Yeah.
Now that you have mentioned vomiting and diarrhea, I have a question. So
Yeah.
there was a time my baby was so sick. All she was doing, she was barely 2 years old. All she was doing was vomiting, diarrhea. Vomiting, diarrhea. So tukaenda hosi, I don't know if this is part of your speciality, utaniambia tu.
Yes.
Tukaenda hosi, and they tried, when they were trying to get some blood to test, but they
Yes.
couldn't get any
Okay.
blood. That's
Yeah.
how dehydrated she was.
Okay.
Then eventually they just told me again in layman's language, amejatuma kama simingi kwa tumbo system, and that's it. Na wakatukaenda na tukaenda home na ikaisha. So is that possible? Mtoto akiwa na homa, is it possible that ajae so much mucus in the system
Yeah.
that ana diarrhea tu na ana vomit, and they don't want to eat, loss of appetite pia, of course fever is there.
Okay. So maybe I would say there are many conditions, whether caused by, a bacteria in the stomach or whatever it is in the stomach, that would have to be done, some tests. Maybe they did some stool tests, and then they identified maybe lots of mucus in the sample. But now it would have to have maybe caused by, several things. I may not be able to point out exactly what it is, but the fact that you went to hospital with diarrhea and vomiting was a plus, because now you want to prevent what? Dehydration. And what medicine you are given is what now is acting on the stomach, whatever bug it is, and then just to cure. I don't know if I've answered your question, but thank God we have hospitals around us, and we are a bit, in a modern setup. But think about someone who's in the Ushago. The hosi is very far. Transport, you have to use maybe motorbike, maybe it's not available. You hear a child, diarrhea, had vomiting. Because the best would have to do with diarrhea is just give them water on your way to hospital. Now with vomiting, if they're vomiting everything, they may not be able to retain anything in the stomach. That means you have to go to hospital for them to get some dawa, either injection or an IV, just to stop the vomiting, so that whatever you give them, they can retain, and now they're strong, their bodies are strong.
So in that case, for mtu sasa mwenye hayuko karibu na hosi, what would you advise they do sasa?
What you just mentioned, give them water,
Yeah.
on your way to hospital.
If
you have- So basically, we encourage plain water, because some people are doing too much salt, and that's too much sodium adding to the body, and sugar. So the best thing would be plain water if you don't have ORS. Now, ORS is the oral rehydration salts that you buy from a pharmacy. If you have that, you can mix. If you don't have, don't panic. Just give them water in a feeding bottle on your way to hospital,
So
and you'll be good.
if child is vomiting, I have no option. Nitafute to hospital.
Hospital, yeah. If they're vomiting everything, that means
Yeah.
mtoto ameamka asubuhi, they're vomiting. You try give maybe some water, they're vomiting. Try squeeze some orange juice just to do away with the nausea. They're still vomiting. They swallow some saliva. They're vomiting. That's what we call vomiting everything. So in that case, you have to go to hospital. And one of the cases I've seen is with rotavirus. Really, when there's an outbreak from school or from a neighborhood or from a play group, then
Rotavirus is not for infants. It can attack even the school-going children.
yes. Like last year, that was PP2 and grade 1 in some school. They were severely affected. So it can happen. And what I got to learn from the pediatrician is that the vaccine that we have for rotavirus doesn't cover all strains of rota. So yes, we do vaccinate, but we might have strains running as an outbreak that are not covered.
And what are the symptoms to look out for rotavirus?
What we just mentioned, diarrhea and vomiting, and
So probably
maybe
she
poor
had
appetite, and maybe poor appetite.
Okay.
Yeah, that's what I would say. So we have a course, or rather a topic in the course that we refer to as danger signs in children. So things like a sunken fontanelle, what we call in Kiswahili the utosi, the part that bobs up and down. If it's sunken, that means the child has lost a lot of water. Another sign is where the eyes are sunken. That means they're also dehydrated. So those are two. And then maybe vomiting or having diarrhea more than 3 bouts or more than 3 times, then you have to go to hospital. Yeah.
Nitakurudisha hapo kwa choking. What are some of the most common choking hazards for infants na children?
Okay, we classify them into like 4. We have food items, that's the main one. So food items, that means, well, I know these days people are doing baby led weaning. It's a bit risky in my opinion, but somehow I think that once the babies get used to, they're good to go. But then ideally we do traditional weaning where we blend the food, and then at month 8 we mash with a fork or something to mash. And then when they are 1 year old, we do family foods, but they are in small cubes. So the food items, we have to cook them thoroughly, as in we say it's thumb pressable. You can press inaingia ndani, iko soft. And then again, under food items, we say we want to avoid lollipops until they are 4 years. If we have to, like for me, I don't go to the shop to buy lollipops. I once heard of a case, a child who went to a family gathering with their parents, and someone gave all the babies, they had a pack of lollipops. So for this specific child, the stick came out. So guess what was left in the mouth?
Yeah.
The hard-boiled, I call it a rock, the sweet, yeah? So of course they're enjoying the sweet saliva from the sweet, and then
to swallow.
so it got stuck, and then apparently from the whole team, the whole family, no one knew what to do. So trying to get a car, get to the nearest hospital. I think it was on this side of Tigoni, and that's how they lost the child. And what we're learning today, like a tip of what you should do, it's a simple technique, and you can just do it. Number 2, we have household items, so things like your earrings, your rings, coins, beads, these pebbles in like the ones I'm seeing behind there. We have plants, potted plants, and then that's category number 2. Then number 3, we have toys in the house. We always, advise parents to buy bigger toys as opposed to the small ones. And what we have from the Kenyan market, they're cheap, yes, but by the time the day is over, amevunja, the pieces can go easily in the mouth. And then when you think of a season like Christmas, where you have a decorated tree with so many things, so when you're shopping, go for big items that can't fit in baby's mouth. So think about your baby's mouth. What can fit in their mouth? So if you're able to buy bigger toys, the better. If it's a big truck, if it's a big doll, and avoid the ones that have plastic eyes stuck on them and a plastic nose, because they can, of course, pull it out and put in the mouth. Now, the reason why they're putting all these things in the mouth is because in a stage called oral stage, which lasts from birth to around 2, some babies go all the way to 3 years, always picking things and putting them in the mouth. So that they want to, it's a stage, they just do it somehow, they get to do it. And then the last category is garden objects or garden items. So things like grass, rocks, pebbles, and then there's some seeds from some trees. Yeah, so those are the 4 categories.
So there's no shortcut around this. You always have to be on the lookout.
Yes.
Always.
So be on the lookout and then have some skills. Well, of course, at the end of the course, we do something we call an emergency action plan, like the steps you're going to take so that in case something happens, at the end of it, the outcome is successful. Like calling for help, when they come, if it's 5 people who come to help you, what will you tell them? Okay, I need a first aid box. I need someone to help me organize transport. Call my neighbor. They can drive us to hospital, something like that. And then how to relax also when you're going through an emergency, like taking a deep breath.
Yeah, kuna
Then
watu
you
wanashtuka hadi
hold.
they can't do anything.
Yeah, and then you breathe
Ama
out.
wanashtuka even the people around them. So everything is at a still
Yeah.
because of their mshtuko. Okay, yeah. So you have to manage yourself. Yeah.
Yeah, yeah.
What about those kids who faint for different reasons? How do we handle a child who has fainted?
So what happens with fainting? There could be several reasons. I remember back in primary, we could do these long periods of standing in a parade. What did you call parade? Yeah, a parade. And I could see, assembly. I could see children, fainting. I think maybe either they were hungry, the heat is too much. They didn't have enough water, so the body is overwhelmed. So what we do for a child who is fainting, again, you want to look at 2 things. Are they breathing? And so how to check for breathing is you put your ear on their nose and then your eyes are on the chest. So you want to look if the chest is going up and down, and then you know they're breathing. And then you want to listen and feel if there's some air coming out from their mouth or their nose. That means they're breathing. And then the next thing you'll check is for their heartbeat or the pulse, which is on the side, any side. Well, there are other places we'd look for, but this is easy to get. Now, if they are breathing and they have a heartbeat, then you know they're okay. They may not respond, but what we do next is to put them on the side, what we call a recovery position. Then from there, they can recover. And if not, then we'd have to take them to hospital, but in this position.
Oh.
Yeah.
So this is applicable in what ages?
All age groups, even
All age
adults,
groups.
even adults. Because
si tukiwa shule when people would faint,
Yeah.
wangelazwa chini and then their legs would be
raised up.
and that's all we'd do.
Somehow it works because you have flow of blood from the legs down to the brain. Yeah, but now we prefer
This is
on the
more
side.
ideal.
Yes.
And
then
sorry,
Oh.
continue.
Okay. So this is more ideal, and then it depends if the child has any condition. For example, the students, actually the teachers should have an idea if they have any medical condition.
Yeah.
Now for those, let me call them high-end schools, we have school nurses, we have rooms we call infirmary or like a clinic, where in case something happens to a child, then they can easily be taken to that room, or the nurse is called to where the child is and they would examine and find out what's the cause. But think about public schools or private schools that don't have a school nurse. So what would happen? Either the teachers make some judgment and then maybe they call the parent and maybe take them to hospital.
Mimi shule nilikuwa watu wa kufaint walikuwa wanaambiwa wanajifanya.
Exactly. I was about to mention that. What would you tell even some parents, family members, teachers? Ati wamefaint, wanajifanya. Yeah, some would even go to the extent of kuchukua kiboko ati anamchapa amke.
Yeah.
I think I remember what they used to do for us in high school. There used to be, I think, a group of girls with what they used to call hysteria, like calling for attention, and then they fall.
Wanataka attention.
Used to use some spirit or something from the lab, put in cotton wool, and then it's brought close to the nose. So inachoma ukipumua.
Yeah.
So that means if they were pretending, they would have to wake up.
Okay.
So that was like a litmus test for them. But that's not.
That shouldn't
Shule
be
za
your
siku hizi,
first
shule za siku hizi at least
so at least to
ziko
check if they're breathing, if they have a heartbeat. Are they okay? Did they eat something? Could be low energy. Yeah.
What about nose bleeding? Pia ni common.
So nose bleeding, we say if I'm the one who's bleeding, then I would have to pinch my nose. Well, wazungus pinch up here. I don't know why, but this is the right place. So you pinch the nose and instruct. If you're helping a child, you'd have to have a piece of tissue or a cloth. Help them to pinch the nose and then instruct them to breathe through the mouth. And of course, they're seated upright. Maybe the only thing they would have to sit at the edge of the chair, maybe their legs apart to avoid soiling their clothes. And then they just pinch the nose for like 2-3 minutes, and then it should be over. If it's brought about by heat, you can add a cold towel, like a wet towel, put it on the forehead, and some even do it at the back of the neck. You can then get an ice cube, wrap it with the wet towel, and also now press it on the forehead.
What is the purpose of the cold towel?
I think it's just to cool it down, to cool the body down if they got the nosebleed from, too much exposure from the sun.
It's mostly caused by too much exposure to the sun, ama kuna other causes?
I would say that's one of the causes. Another cause maybe for the older people is high blood pressure. And then there are some if they have issues with the blood vessels, the small blood vessels, the capillaries supplying, the nose, and they get these frequently, then they would have to see an ENT doctor. Like, for example, children who sleep, when they wake up every day, the pillow is full of blood. Now, if you see that trend, then they would have to see a specialist, that is an ENT doctor, ear, nose, throat specialist. Yeah.
And these people who they pinch their nose, yes. Lazima wakae hivi. Wanakwambia hapana usikae upright, damu itamwagika yote.
So leaning, so facing upwards, like facing the roof is not recommended. It's just to be, like in this position. Yeah.
So in school our teachers didn't do anything because those are the things they used to do for us.
And again, back to the high-end schools, the teachers get to have refreshers of such courses.
Nice.
Refreshers.
Mesikia mtafute pesa
but
watoto
think
waende
ago-
high end.
Yeah, we're in the academies.
But tukifunza watoto wetu, something I learned is that even a child who's in, let's say 6 and above, they're able to grasp these skills. Even a 4-year-old, we see you doing this.
I saw a video on TikTok. There were 2 kids, a toddler, tuseme ako 5 hivi.
Yeah.
And then akona katoddler kengine kadogo ka 2.5 hivi. Wamecheza with they were playing even with they were dancing together with their mom nini. And then this child akachukua something akaeka kwa mdomo. But this bigger kid akaona alienda kamemtoa immediately kwa mdomo. So I think even teaching the older kids is
very important. And something else I noticed, when you teach your child who's, let's say 5 and above, they'll grasp these skills, like for example what you just did earlier on Heimlich maneuver, and then you challenge them to go teach their fellow students. Like during lunch break, tell them to, try do this, teach them how to do it. Because something would happen, like maybe during break time, during lunchtime, teacher has gone to take their tea, their lunch. So who's left with the children? There's no minder, there's no assistant teacher, like in the, those high-end schools. So what do you do in case something happens and they've learned from their friend, then they can even save a life.
Yes.
Yeah. A 10-year-old child is strong enough to help their friend, even a 6-year-old, as long as they get to learn how to do it. This reminds me, there are few schools where I have done the same training for girls and boys who are in not Scouts, Girl Guide, but just a bit that they can understand, like choking and CPR, just a bit, and how to handle maybe things like cuts.
Yeah, so you've heard it. She can also train your children. So sign them up too.
Yeah. All right.
Wow. This discussion is interesting. I am learning. I don't know if we can now move to the buns and the cats. Dear Zoo, can we move there? Where you have something
Niko
else
kwa
before that?
allergies, but we can do
move
allergies
there.
after.
So talk to us about your immediate action after a cat, a bun, especially watoto wanachomeka na maji moto, uji moto, chai.
Ameshika sufuria,
Ameshika pasi, gas.
Yeah.
Oh my God, I know. Fractures. Kwanza sahi, my daughter is at the age, she's jumping from one chair to another, from table
Superman.
to where,
Okay. So maybe you can start with buns. And for buns, again, we classify them into 2, small buns and big buns. But for the sake of home first aid, we would always say we avoid putting unga and Colgate. I don't know what else I've heard about,
for the buns?
For the buns, yeah.
Oh.
So what to do is to quickly, as soon as you get to notice that a child has been burnt, rush them to a source of water, say like maybe the kitchen sink or the bathroom sink, and then put their hand, if it's the hand or if it's the leg, put it under cold running water. Ideally for 20 minutes if possible, but don't wait and then now go to the tap. is once mtoto amechomeka, take them there and
Immediately.
then put it under cold running water. But it works wonders because it prevents the skin from getting blisters.
Okay.
Yeah, and then if it's painful, once you're done, you can always wrap a wet cloth with ice and now place on the surface. It won't burn, it won't be too cold for the baby, but it's going to give them a cool, warm
It's going
feeling
to suit them.
to soothe them to be able to sleep. Yeah.
Sila tunaishi Kanairo.
Eh,
Maji, running water.
Ni
Saa
shida.
zingine running water hairun.
Okay,
So can we soak the leg or the hand?
Yes, we can. Hata ushago where there's no flow in water,
Yeah.
ya tap, we can use
soak.
water in a basin, put the leg there, put the hand there. However, you keep checking kama maji imekuwa warm because of the body temperature. So what you
keep changing the
do,
water.
so have like 3 of them,
Okay.
close by.
Yes.
You can, exchange the water, ama move the child to the next ka basin.
Mimi kitambo I never thought ati hii kitu inafanyanga kazi.
Nini?
Nimechomeka, nenda naeka hivyo,
Kama
alafu sijui nafaa kuweka for 20 minutes.
Ni kwa 20
So
minutes.
nikitoa hapo,
Unaeka
niko
tu
like,
for a
mbona
few
bado
seconds.
mbona nasikia
Uchungu. So then if you do it for 20 minutes ama 10 minutes, 10 to 20 minutes is good enough. You notice that hata ukishaondoa that leg ama that arm, it's painful because of what just happened. So cooling it with a cold pack would work well. That is after.
Oh,
And
you
of
don't
course,
put a cold pack on it.
you first run it under cold
Immediately.
water, and then now the cold pack is ni kama ya maintain. Yeah, and then if possible, if it's too much, maybe pain, if there's too much pain, go to hospital.
And when it's the burn is too much, hadi ngozi sasa imetoka,
yeah.
skins are hanging, do you still run it under water?
So what we classify as big burns is where, for example, a child got hold of your hot cup of tea, like on the table, and then it spilled on your face, their neck, their, chest, stomach, legs. That's a big coverage. Well, in the hospital, we calculate it into percentages, degrees, yeah. But now, at home, what we say, the first thing, if a child has hot liquid on their clothes, then the first thing is to remove them. So remove, the clothes that are wet, that have the hot liquid, and then now cool the wound. So what I always think and try to imagine, if you have a basin or a jug with cold water, room temperature water, sini baridi, just, pour on it, mwage tu pole pole, once, twice, even 3 times, and then I'll go to hospital. And of course, on your way, if you notice that the skin is a bit burnt, then get something light like a lasso or a flannel, like that's cotton and light, because they have no clothes on them. So just for privacy, and then tie it somewhere here, so it's like you're covering them this way, tie it here, and then now carry them to hospital.
That is just for privacy.
for
Otherwise,
privacy.
kama tungekuwa tunashughulikia privacy, tumbebe tu hivyo.
Tubebe tu. Alafu,
Okay.
now what would happen with a big burn, ama too much heat exposed to the body, is a shock from too much heat or too much pain. That's the reason why you need to go to hospital.
We?
Yes. Scary.
Go pressure.
All right. And then next was cuts.
Yes.
Basically, what to advise, I know we buy Savlon and Dettol and all those things. I still hear people using spirit. So the best thing would be slightly salted water. We call it saline or maji ya chumvi. Of course, you wash your hands, then prepare, even koroga small, a little salt in a cup of water, and then get a cotton wool and just clean the cut. If it's a small cut, just clean it, put an elastoplast, or a band-aid. And then if it's a big one, it's a deep one, the first thing you have to do is to put pressure. And then now clean it and then take them to hospital. Yeah. What else did we...
Fractures.
So for a fracture, we have what we call signs of a possible fracture or dislocation. Fracture is a broken bone, right?
Yeah.
And then dislocation is where maybe the joint is out of place.
Ametwist mguu,
Sasa,
ametwist sijui nini. Yeah.
so kutwist would call it a sprain. But if any of those happens, we want to look out for 3 main signs. If you see a child has too much pain that they don't even want you to examine it, you're trying to hold their hand, they don't want you to examine it, and then maybe it's swollen, like a big swelling, and then lastly, if it's the leg, you feel it and it feels too warm,
Yeah.
warm more than the rest of the body, then you suspect what? a fracture or a dislocation. So what we'd have to do is to get something hard. So this is a splint used in the hospital, but at home you can improvise, like use a magazine or a newspaper, fold it, or a carton box, or even a remote, or even your case for your glasses. Yeah, so anything hard. So if you're out in the bush, you can even use what do we call it? Like a broken branch of a tree, and then just wrap it with something to soften it. So you'd have to use that hard surface, place it like this, and then now use, this is a crepe bandage. So what you need to do is to put, if it's the knee joint, you want to tie something like this to put it in place.
Tumeona kwa movie.
So you do like this, and then now take them to hospital. If it's the arm, if it's the the wrist, just immobilize it. So what you are doing here is to immobilize, meaning that the joint is not moving up and about to cause more injury or harm to the blood vessels, to the nerves, and then now you can take them to hospital. Actually, the doctor is going to be very happy because you have minimized more injury, after the fracture happened. So I think we're done with fractures.
Yeah.
Okay.
Okay.
Also for sprain, tunasugua na kaluma.
So for
By
sprain,
the way, unajua kuna
Wacha nikusugua, utasikia vizuri asubuhi.
even simple falls, like as you're answering that, pia unaweza comment on this. Even simple falls, mtoto ameanguka, amegongwa hapa, the first thing is kusugue na nguvu kwanza as you're pressing in.
Okay. So let's start with the sprain. So sprain, even if you're walking down the stairs on a hill and then you sprain your leg for you as an adult, then kaluma can work. So just massage. Now look out for too much pain and swelling. Like day 1, day 2, ama day 1 ijaisha, but it's too painful, then just go to hospital. Because something else that would happen kwa, that elbow joint is torn tendons or torn ligaments that have to be sorted out in the hospital, or rather in the theater. Now back to falls, that's a different now topic. Falls, ya mtoto, for example, you let's say, it depends with the height. For example, if the child is learning how to climb on this sofa, and then in the process they hit the ground, of course, watalia, they were shocked, but what do? You pick them up. So what we do mostly for us African moms, we want to rock. Oh, sorry, baby, you'll be fine. So what so what you're advised is to avoid rocking them so hard, because if their brain was shook, during that case, we want to hold them still, and then only your hand moves. Sorry, baby, you'll be fine. So kusugua is okay. Well, that's my opinion. It's okay to sugua because somehow it prevents the swelling or the bump from becoming too big. The other option, once they get a bump, you get the ice pack. What we termed earlier on, that's a wet towel. Wrap it with an ice cube and then now sponge it as long as they allow you to sponge, Yeah, but if they fall from a very high height, we have to take them to hospital.
Just to be sure.
Yes, to rule out things like a concussion where the brain is shook and they have certain signs. They start vomiting too much. They look like they're drowsy, like they're not coordinating. Yeah.
So those are the signs of a concussion.
Yes.
Tell us about allergic reactions. Nasikia mtu akona allergy ya peanuts,
mayai.
No, the instant ones like
asali pia ni instant. I don't know.
But peanut najua kuna mtu akikula peanut tu hata aonje kidogo anaanza kureact.
Okay, so now we have again we classify them in two. Let's say two mild allergic reactions. Now the mild ones, someone who takes eggs or beef or something that they're allergic to, they'd get what we call hives, some of the big pimples that are itchy and they're red. That's a mild reaction where you just apply an antihistamine cream and then you give them antihistamine tablets if it's an adult or antihistamine syrup. And then when it's bad, when it's severe, now they have those hives, then it progresses to having swollen lips, swollen eyelids. They're like big balls popping out. And then the lips are, this big. And then the body is also swelling up. The face is puffy. Now the worst that can even kill this person is where the airway swells up from the inside. Assuming this is a tube, the airway, it swells up and it closes up completely. Some of these causes are bee stings, but you notice that this risk of anaphylaxis is different for different people. So until you have that trigger, that, first time happening, with this trigger, you can't know, you never get to know. So some of the causes are bee stings, and then we have wasp stings, and then, nuts, like she mentioned, nuts. And then we have some type of fish, they call them crustaceans, things like
Sushi.
shellfish. I think shellfish, yes, because they have a shell.
Yeah, sushi.
Nice sushi. Okay, that's good. Get to learn,
We're learning something.
And then I also had the same with a scorpion bite, something like that. So now the remedy for that, if they already know that they have an allergic reaction, what they call anaphylaxis, the doctor will always tell them to have an EpiPen with them. Yeah.
Okay.
All right.
So your EpiPen is for all
Allergic reactions. But of course, the doctor would have to do several tests.
Yeah.
And once you see any first-time reactions, just what you've just mentioned, we just get to rush them to hospital.
Mindigani EpiPen ni epilepsy.
EpiPen, epilepsy, near allergic reaction, is what we call anaphylaxis. And again, of course, in class, you learn how to use it if they have to. And of course, the whole community, either in class or at home, they get to be taught how to use it if that baby is exposed to such kind of reactions.
Okay.
Yeah.
Okay. So tell us the basic things you should have in your first aid kit at home.
Okay. So I would say anyone with a small child, the first thing is Panadol, or paracetamol syrup, whatever brand you have, because, you'd find one, very costly and one that is, quite affordable. So paracetamol is a must. And then an antihistamine cream for any allergies. Think about something happening at home, maybe it's just swelling up. Before you gather up whatever you need to gather to go to hospital, antihistamine syrup is very good. But then understand the name, what it is, so you don't give the wrong medicine.
Yes.
And then if you're confused, if you're stuck, always call your doctor, pediatrician, or a health provider, and then they will tell you what to use. So that's paracetamol, antihistamine syrup, antihistamine cream, and then maybe something for the stomach. Maybe for children 2 and above, you'd have to keep something for stomach cramps. If they're having stomach pain, they ate something, they didn't wash their hands. So, and then maybe some saline for cuts, for wounds. A thermometer is also a must to have. And then a notebook, a small notebook, a pencil to note what time you gave the baby what medicine. Like now, if you leave your caregiver at home, tell them to note what time they give the baby paracetamol before you get home. And then there are other things that are not a must to have, but if you're able to, something like what we call a CPR mask. So if you want to breathe on someone else, it's a stranger or someone, but at home, maybe it's a neighbor around. I think that's that comes to mind, but I have a whole list of what you should have in a family first aid box. And of course, items for an adult, painkillers, antihistamine tablets. If you have someone with asthma, then you have to have an inhaler in the first aid box. If someone has risk of anaphylaxis, you need to have an EpiPen in the first aid box. And then things like band-aids or bandages, things like Eno for stomach upsets. And then something like pain balm for the joint pains.
ORS.
Yeah, ORS also good. Good student.
Yeah, I learned my lesson.
Good student. And then of course when you're going for safari, so like if you're going for holidays, so those are things that you must carry. So you can try condensing like a small bag or like a small container, but at least have those basics for baby.
Very important. Very important because things happen. Yeah.
And what are some of the steps that one should take if a child has a head injury? Amejigonga ama ameanguka akagonga. Because unasikianga mtu yeye ameanguka, umeumia wapi? Kama ni kichwa.
The first thing is to minimize movement. For example, we said if you pick them up from the ground and they look like you're stuck there, we said we will hold them still, avoid, movement, minimize movement. Just say sorry, you'll be fine. And then we said we look out for signs like too much vomiting. We call it projectile vomiting. And then signs like they are off. They are, what will you call it? Unresponsive, and they're not like alert. It's like they're confused. Yeah, and then you'd have to take them to hospital. But again, minimize movement.
So those things you've
we're used to-
mentioned, are they signs of a concussion?
Yes, they're signs of a concussion.
Okay.
So projectile vomiting. What else did you say? Unresponsive, and then they look like they're sleepy. A doctor will always tell you if a child falls, never allow them to sleep.
Yeah.
And then if you see those signs, of course, we rush them to hospital.
Or never allow them to sleep.
To sleep when immediately
Or
when it happens.
immediately. Or because sometimes they cry, then
and then
they sleep.
So I think it depends, because I've seen a child fall close to their sleeping time. They cry, but of course I was there with them. But yeah, so those are the signs to look out for.
Okay,
Yeah.
okay. Alafu tumetaja hapa, tumeambiwa tu hapa uko na classes. You know, they can sign up. They can sign up their house managers, their children,
yes.
and everyone around them.
Yeah.
So, how do they sign up? And
Okay.
if they want to interact with you further, utafute wapi? Yeah.
Kwa social media pages, tuko kwa Instagram, known as Total First Aid with Priscilla. So you can look out for that page, and then maybe you can send a message over there. We have a phone number. I don't know whether to
Yeah, you can
you
share.
can share.
Please share.
So you can WhatsApp on 0724773062. Yes, and you can reach me. And of course, I get to work with a team. If it's a day that I'm, tight, I have, 3 nurses that we work with.
Are you on socials?
Other
Yes,
socials apart from IG?
Instagram and Facebook.
Okay.
TikTok, kidogo, not so active, but it's there. I think I have 2 videos. One on
Not how to train hizo ulipe watoto video like short ones.
Yes.
Yeah.
Yeah, we'll see what to do. We can work on them.
What's your
Yeah.
handle on TikTok and IG?
And on IG is Total First Aid with Priscilla.
Yeah.
TikTok may disappear. Nurse.
It's okay.
Yeah, I'll find out.
Tutuweke.
I'll find out.
We'll put it here.
In a blackout.
Tutawekea.
Okay.
So when they reach out, ndo sasa wataget kuno how they'll get involved in the classes and all that.
They just send a
Yeah.
message, like on IG, very active on IG. They can send a message, and then I'll respond, and then I'll share a link with a calendar that you can pick a date. If they have any questions, and I'll respond to them.
Nice.
Yeah.
Nice. So they can pick a date. You see, so there's no excuse for you not to sign up for this thing.
Yeah.
So you're telling us you can be flexible with their time.
Oh yes.
Nice. So tumewapea solutions hapa, tumewasaidia.
Yeah.
Yeah.
You know?
Sign up for those classes. I also wanted to ask, what are some of the common myths about first aid that you would want to share?
So one of the things is that that it's for high-end people, but no. And then something else is that it's hard to do it. People believe that it's hard to do what we are learning, but then you get to simplify it, to the lowest level, even at home.
I like the way you go, unaenda unashika hadi wale wa mashinani.
Yes, which is
nice.
really
Oh,
nice.
nice.
Yeah.
Thank you.
Now, hii story ya kukusing it, I think you need to view it as an investment to yourself.
Oh yes.
Yeah.
Oh yes. Oh, yes.
Or a preventive measure.
Yeah.
Because hizi story tunasikia huku.
Imagine you're here shooting, your child is choking.
Yeah.
Even when you were talking about the burns, I was just,
I was burning.
people need to learn these things, and I don't know why hospitals need to offer these lessons before you give birth. I don't know why they are not doing that.
I think they're trying. The hospitals that are offering a shorter version, of first aid, like the basics. Yeah, so we are trying. Najaribu. Yeah.
I think even religious institutions should do that, because we have children there. In my churches we have Sunday school children there. Mtoto wamecheza wamegongana, mwingine ana nosebleed,
Yeah.
mwingine amefaint, mwingine sijui tumbo. So I think it's good that if you're watching and you're part of an institution, go there, give that idea that you should have those classes and call her. Reach out to her. Very important.
I think something else that comes to mind, I've remembered, very important is for every household to have a game plan for your house. If you're going to be away for work, say like a whole week or 2-3 days, then tell your nanny or your house manager, this is what I want you to do in case an emergency happens. Actually write for them. Step number 1, step number 2, step number 3. And one of the things that are involved is to have a list of emergency contacts. That means you'd have to put your number, your maybe partner's a number. If you have a good neighbor, put their number there. Then right after that, put phone numbers za daktari na pia ambulance. For example, it depends where you stay. If you have a big, nice hospital, well equipped, and they have ambulances, get to know their phone number, put it there. I got to know about something, an ambulance called Flare. I hear it works like Uber. So if you subscribe and say like you're in what part of Nairobi, whatever part, they get to position the ambulances in different parts. So now if you're a member and you call their number, they have your details, they know where you live. So they'll just send the nearby, as opposed to maybe me subscribing Amref and it's on Langata Road and I'm on maybe Westlands, Kikuyu, and it's quite far. Actually on a weekday, on a busy day, time ya rush hour, it will take them forever unless you want them to evacuate you from, far places. So anyway, it's good to have a list of emergency contacts stuck by, somewhere behind the door, besides the fridge. Otherwise, I've seen a case where an emergency happens and the lady had her phone in her apron.
And she couldn't hear.
And then she was going around the whole house looking for the phone to communicate to the parents that something has happened. But she can't find it. You have given her all the contacts, but ziko wapi? Kwa simu. So when you have them printed out, it's easy. Because if I open the door and say, help, and then maybe a neighbor or a stranger comes in, I can tell them, okay, there's a phone number behind, that door. Please call them. This is what you tell them. And of course, in class, we learn how to be calm when an emergency happens.
Sign up for those classes, guys.
Yes, okay.
Please do. Tumejifunza mengi leo.
Nice.
The things we take for granted kama first aid. Unajua, utasikia ka story kwa mtu mwingine, but don't let it be you.
Right.
And yes, God is watching these kids, but we also have to be vigilant.
To be prepared.
Asante sana, Aki. This has been so helpful. Eye-opening.
Karibu sana, tena tutakuita bado tu.
We
said you are midwife
other
once in your long ago.
we have questions.
We have questions.
Around midwifery.
And beef with midwife.
Oh my goodness.
And beefs with midwife.
Wachapa.
2 fingers in the sky.
Oh my
What are
goodness.
those?
Wanakuongelesha vile
Wiping us.
Poleni.
Okay.
But we're so happy to have you.
Thank you. And before we almost forgot. Can we look at these things?
Oh, all right.
Maybe you can even open. Maybe you open, you show us. You can even demonstrate how to use it.
Right. So this is an EpiPen. It's a used one. So a new one should have a blue cap. So it has steps. It shows you step number 1, step number 2, and 3. You can see. So of course, for a child who has to use an EpiPen or an adult, the doctor will take them through the same steps. So the first step, it's an easy one. You remove the cap, the blue cap. It gets to activate the needle inside. And then number 2, you get hold of the EpiPen like this, and then, expose maybe the thigh, and then
And is
press
the
hold.
thigh the only place we can use it on?
It's a good place with some good nyama, mama soup.
Oh, yeah, because hata kwa movies, it's just the
It's the thigh, yeah.
Okay.
And then from there, it says you hold firmly for 10 seconds. And then the next step, now go to hospital, rush to hospital. And then once you get to an emergency room, you say anaphylaxis or an emergency. And then they will, take over from that.
So what exactly does it do to the body?
It will reverse the effects of that allergy. In short, it's going to save a life. Yeah.
Oh, it will reverse the effect.
Yes,
Okay.
yes.
So ako ka shimo kadogo nimeona hapo, that's where the needle
The needle
comes
come
from.
from. So, well, this is used, but so the needle went back in. So after
after
you may
I've
release
used.
dawa, it will go back in. Well, kind of like
Oh, so it's just one needle inside.
automatic somehow. Yes, yes. It's a one-time use. So this is
Makes
good to
sense.
throw away. Yeah, once
Okay,
you
okay.
use.
And I see your needle ni kubwa sana if that's the whole.
Sasa hiyo
It's
una
so
time ya
big.
kuogopa uchungu ya needle.
Really?
So hiyo
So
ni
there are
save
two.
a life.
There are actually two. So this is for a young baby, and then kuna
For a
ingine.
young baby.
But it's made this size so that you can manage to hold with your
Yeah.
hand, and then now give them that jab.
So later huyo mtoto atasikia uchungu ya hiyo sindano nono hivyo.
Umesave lives. So
Umesave
uchungu
lives. It doesn't
itaisha.
matter.
Bigger picture, babe.
It will
Bigger
be a big
picture.
deal.
Bigger
Yeah.
picture.
Yeah.
Wow.
Yes.
Yes, and this is just a thermometer.
It's just a
right?
common, what most of us can afford. We call it a digital thermometer. And of course, there's a button there, and then you just switch it on, and then wait for it to read L0. You can see L.
Oh, okay.
And then now, I'm sure you've used these things. And then now, you put it there. But of course, for a small baby, 0 to 6 months, we put it upright like this. Well, my baby has clothes on, but
Why is
it should
that?
be skin to skin, so that the metallic part gets to
Okay.
absorb the heat and then give you, once it beeps, it tells you the right temperature.
Okay.
And then a baby who is 6 months and above, you do it from behind, because that's the time they're curious, they want to see what is this. So if you do it from the front, they won't give you time to check. And then when they're big enough, like 3 years and above, you can say, hey, I feel you're warm, let's check your temperature. And then you do put it here, and they can help you read the numbers. And then once it beeps, then you get to know the right temperature.
Wow, interesting. Yeah. Ebu, tell us what you think about everything she has said in the comment section.
Okay.
Ask your questions.
Yeah.
What else? Tell us if you want her here again to just elaborate on everything she has said. Maybe you want to hear it again.
Oh, yes. Okay.
Yes, but we're definitely having her for the midwife talk.
Okay.
Tunatoa hasira yetu na yeye.
Okay. Nitajaribu kujibu maswali na kutetea wenzangu.
But you have done such an amazing job.
All right.
Yes, you're a good teacher.
We are happy to have you.
Thank you.
So guys, if you've enjoyed this episode, please comment down below, like
Yes,
this
please.
video, share with your friends,
Yeah.
subscribe.
Sign up for the classes.
Yeah.
Reach out to her, namba yake tutaweka hapa kwa screen.
Yeah.
Yeah, and see you next week. Bye-bye.
Bye-bye.
Thank you.